Hello everyone, my name is Max Tkachuk, and today I will be focusing on the question of what can healthcare providers do to minimize the implicit biases that African Americans face. So first off, before we talk about the solution to the problem, I wanted to identify the problem first because I believe that that's an important first step to make. So what are some characteristics of implicit bias that make it so difficult to solve? Well, first off, it's subconscious, which means that it makes it harder for us to recognize and correct the behavior because we don't know that it exists within ourselves. We don't think about it. And in fact, it often runs contrary to what we consciously believe. So if people ask us like, "Are you racist?" or and then the natural response would be, "Obviously not. I'm not." Um, but those are our extrinsic beliefs. But unfortunately, implicit bias is rooted deeply within ourselves, so we're not aware of it. So what happens then is that we tend to make rapid and automatic connections between certain groups of people, and then there's certain stereotypes that are associated with those people. And those mental associations ultimately end up impacting our attitudes and how we feel about those people once again, which ultimately impacts the way we communicate with them. So then why is addressing this implicit bias so important? Well, first off, it would help address a root cause of racism and a root cause of one of the major health disparities in this country. Um, we would be digging deep within ourselves to truly find out what can we do better from within instead of looking on the outside. And another reason why implicit bias is so important to solve is because currently many tools are used to prevent explicit bias. So basically preventing from truly showing it. But this approach, once again, would dig deeper and look at ourselves from within. And it also creates a mismatch between the diagnosis and the treatment of the problem, because if we are currently focusing on preventing explicit bias when the root cause lies within, then there's a mismatch between the diagnosis and the treatment. And another reason why it's so important to address is because, well, certainly we can't eliminate those implicit biases, but we can train ourselves. There are techniques out there to not act on those biases, and this would represent a preventative approach, because I feel like a common theme in this country as far as healthcare is that we are not preventing certain issues, but instead we tend to act on them once they already happen. So we have an emergency response system, but we're not preventing issues before they actually happen. And addressing implicit bias, I feel like, would be a great way to do that. And then also by addressing implicit bias and kind of having an open-minded approach to it, is that it would reduce the shaming of ourselves and others. And sometimes it's important to just admit and acknowledge that, yes, we do have implicit biases within us, and there's no way around it. We were raised in certain cultures that are different from other people, and there's just nothing we can do about it. And then we would also, by reducing the implicit bias, reduce the ways in which we shame other people. And once again, that would show up in the healthcare field through the way we interact with African American patients. So why is change necessary? Well, I wanted to bring about some statistics that kind of point towards and explain why this problem is so important to solve. Um, in general, not just for African Americans, but for various racial minorities, overall by 2050, around 52% of the US population will be people of color, making this an extremely relevant and pertinent issue to solve. And then some other statistics as well include Black infants being more than 2 times as likely to die compared to white infants. 10.9 compared to 4.5 is more than double per 1,000 births. And another kind of direct reflection of those implicit biases and healthcare disparities as a whole involve life expectancy between white and black Americans. Because for white Americans, the life expectancy is almost 5 years higher compared to the black people. And this is also in part related to the uninsured rates, because the uninsured rate for black people is about 10% compared to 7% for whites, among the non-elderly population that's not covered by Medicare. So while 3% may not sound like much, but it is a huge difference and a huge number of our population. And then why is change necessary? Well, also because implicit biases can influence the way we interact with marginalized groups and impacting their quality of care. So even for those who are insured, they still may not receive the best quality of care because they're not receiving the best possible intercultural communication from the healthcare providers, which is why I wanted to focus on this issue. So, what specific techniques can be used to minimize implicit bias? What can we do as healthcare providers? Well, as I mentioned before, the first step is acknowledging that those implicit biases exist, and this requires a flexible and open mind. And sometimes this is actually the hardest part for us to recognize that, and because in our minds, we don't have any implicit biases, we're all great people, and while on the outside that may be true, once again, those are subconscious. So the next step, after we admit and acknowledge that we do have implicit biases, we need to recognize the impact of those biases on the way we interact with patients from African American groups, and asking the question of how does it make the patients feel and how does that impact their quality of care is of paramount importance. So ultimately what then needs to happen is we need to gain self-awareness. So making a list of what certain groups make you feel to learn more about yourselves, because when we interact with certain groups, it evokes certain feelings based on those implicit biases. So we need to observe our own feelings and gain conscious awareness of how interacting with different groups makes us feel. And we can also use other tools like online self-assessments to learn more about ourselves and learn about what words do we associate with different groups of people. Because those mental connections happen in less than 1 second, subconsciously once again. And then, of course, we need to incorporate intercultural communication skills when interacting with African Americans. So this is where things like active listening and nonverbal communication comes into play, because ultimately that will also help us communicate and reduce implicit biases that we may have because it will truly foster understanding. So I feel like it's one thing to talk about certain things that people can do to improve their implicit biases, but it's another thing to actually get people to do it. So I wanted to provide a specific action plan and something that can be easily attainable for healthcare providers on a daily basis. And it's amazing, I feel like, what these steps, how big of a difference they can make. So what specific steps should healthcare providers take to improve? Well, I would like to challenge all healthcare providers to reflect on just one patient interaction, it shouldn't take too long, with an African American patient per day. And of course, this doesn't only apply to African Americans, it can be a patient of any different culture that you feel like you would like to understand more and improve on. So what is a part of that reflection? Well, it would require us to ask certain questions about how the interaction went. So for example, the first one being, what did I say to the patient? So certain explicit and implicit messaging that was shared. What kind of meaning did we want to convey to the patient? And then the next very important part of reflection is thinking about, what did I think about the patient? So before the patient even said anything to us, before they communicated with us, what beliefs did we come into the room when interacting with the patient? What did we think of them, just simply based on their race? And then the next question that is really important as well is, how did the interaction make me feel? So that could raise awareness for certain implicit biases that we may have towards that group, because ultimately those biases evoke feelings and impact the way we interact with them. So recognizing that is a crucial step. And of course, it goes both ways. So not only how the interaction made me, the healthcare provider, feel, but then how did those feelings that I have towards that patient impact what I told them? And ultimately, how did I make the patient feel? So was the message that I wanted to convey conveyed effectively? And did I provide the most effective possible quality of care? And did I communicate effectively? Is something to question ourselves. And then as another part of the reflection, I would also add and ask, what did I do well? And what could I have done better? And of course, I feel like every interaction, there are certain things we can improve on, especially intercultural ones, where we might not be as comfortable based on the feelings that we have towards the patient. So what did I do well, and what could I have done better? And that is the driving question that I challenge everyone to answer when talking to African Americans and trying to minimize implicit bias within ourselves. I feel like this plan, while it will not take long at all, once a day, it can make a huge difference. Thank you, everyone. And these are the references that I used.